Following segment is sponsored by Optum Utah. Well, it's that time of year again. Medicare open enrollment is upon us, and Dr. Christopher Valentine from Optum Utah is here to share how you can pick the best plan for you. Welcome to the show, Dr. Valentine.
Thanks so much.
Great to have you on the
Appreciate
show.
it.
Now, just set the table here for all of us. What is Medicare Annual Enrollment Period? What is that?
Well, this is a time every year where Medicare beneficiaries can take a moment to really reassess and can determine whether the current Medicare plan that they're signed up for is the right one for them. And so there's a period that runs through December 7th that allows them to make that reassessment and to talk to a licensed insurance agent to make sure that it's the right fit for them.
Because things change in our lives, different things and different placements, so there's a lot of options that are out there. So choosing the right Medicare plan for me. Let's start with step one, assessing individual needs. Is that right?
Yes. I think understanding how our lives change. I mean, as we're getting older, our circumstances change, the types of medications that we're taking, the types of chronic conditions that we're having to manage with our physician, those are going to change year to year, and that may impact what kinds of benefits you need.
That's right. So step two would be that medication, considering all those changes that we might have in our lives. Or
yes.
Whatever we're up against. Is that right?
That's right, because hopefully as we get older we're staying healthy, but there's going to be more attention to prevention and making sure that we're adherent to the right kinds of medications, and there's significant costs associated with that, and being able to manage that in a sustainable way really needs to be part of that conversation.
Absolutely. And then regarding coverage, what's the difference between Medicare Advantage plan and traditional Medicare plan?
Well, some Medicare Advantage plans may cover some additional benefits.
Okay.
For example, additional dental benefits, vision, hearing, and other medical management plans that are really focused on prevention, focused on keeping people out of the hospital and keeping them at home and making sure that their chronic conditions are getting the care that they need.
So once we figure out the plan, the course of action, what we want to do, what are the next steps?
Really, it's important to identify and to meet with a licensed insurance agent. I mean, I'd often have patients asking me, what kind of plan should I have? And I said, really talk to a professional to try to understand what is the best mix for you, because they will be able to give you those answers. So I think it's going to be important that they call the number that's on the screen in order to understand and get connected with the right kind of insurance broker.
It is kind of confusing at times, so it's nice to have someone in our court as an advocate. Of course, Optum Utah is doing that. So where can we go for more information one more time?
Well, if you want to look at the website on the screen, you can get more information and they can connect you with a licensed insurance broker.
A lot of resources out there, but December 7th is the date to keep in mind, so it's time to act right now.
That's right.
Thank you so much for being on the show, Dr. Valentine.
Pleasure. Thank
You're
you.
Awesome. Appreciate you.
Thanks.